Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'm Dr. Taves, your host, and on this podcast, we are going to talk about prolotherapy and the effects on headaches or migraines. Now, this is a podcast episode that comes from a listener reaching out through our Instagram and asking for this topic to be discussed. And I super appreciate that because it gives me insights into what y'all are researching and finding out there as far as treatment options. And then I'm also honored to be able to speak into this from our perspective and our approach here at Novera Headache Center to help you guys navigate and understand what the next treatment might look like for you. So a few things just to get started. This is just a guide, really, just a high-level overview of prolotherapy and then its implications with the underlying problem that we're seeing with headaches and migraines. And so this episode is informational, definitely not a treatment recommendation, but an opportunity to better understand these different emerging approaches in our healthcare system, things that are available. Prolotherapy is still very much on the fringes, so you'd have to seek it out. It's not necessarily going to be commonly prescribed in the traditional channels, but it is out there and something that's growing in popularity and in evidence. And it's something that clearly people with headaches and migraines are researching, and there's a growing level of evidence to say that it can be helpful. So it's an appropriate time to talk about prolotherapy. All right, so if you're listening to this and you have no idea what prolotherapy is, we'll start by defining what prolotherapy is and the mechanism it uses to assist in the healing process. So prolotherapy really is just a shortened version of saying proliferative therapy. Proliferative meaning that there's an inflammatory response and replication of cells and laying down of collagen cells in particular in order to stimulate healing, and specifically as it relates to tendons or ligaments. And so what's happening here is there's an injection, so a needle's inserted into the target tissue, near the target tissue, so a ligament or a tendon, and there's a solution that's injected. That solution is it's intended to be a local irritant. Oftentimes it's a solution that involves dextrose or a sugar, and so it's think of like sugar water in a sense, is injected into a specific area, the target tissue, and it's going to cause a local inflammation, so kind of like a controlled local inflammatory response. And within that inflammatory response, there's going to be a reaction, sort of the inflammation locally draws attention to the area, and the idea is that we're stimulating and encouraging the body to focus on that specific area in order to speed up the healing process or to stimulate healing. And within that healing process, we can see additional collagen fibers laid down. So the whole idea is that tendons and ligaments are going to be strengthened through this prolotherapy approach. Okay, so later on in the podcast, we're going to relate prolotherapy to different types of tools or interventions, one of those being dry needling, and we're going to compare and contrast the two. But that's at a high level, that's prolotherapy. So proliferative therapy, injecting dextrose, a type of sugar water, into a specific tissue, meaning ligaments and tendons, in order to stimulate the healing process through localized controlled inflammation so that there's a laying down of collagen, and the tissue itself will become more stable, reducing inflammation, increasing stability, and reducing that location, that specific tendon or ligament, as an irritant because you've stimulated the healing process. All right, so why that would have any implication when it comes to headaches and migraines. So when it comes to looking at something like prolotherapy and why it would be helpful at all for the situation that we've been talking about, and that the lens that we view headaches and migraines through here at Novera Headache Center is the neck primarily, but also shoulders and jaw, having a dysfunctional pattern. There's irritation within these areas, and the pain signal is sent up into the head or the face, reproducing and causing the headache and migraine symptoms that you experience, okay? So when it comes to something like prolotherapy, increasing the attention and inflammation to a localized, ligament or a tendon for the purpose of healing and increasing the stability and structure of that ligament and tendon, it can be effective when we just think through the problem and this being a solution. Okay, so I've talked before about hypermobility within the neck, and it's not uncommon for patients with headaches and migraines to have hypermobile segments of the neck. One of the things that we see very commonly is that the joint laxity in these patients with headaches and migraines, not exclusively, but a large percentage of them have an increased level of joint laxity. Now, if you rewind, I think it was 3 or 4 podcasts ago, I talk about EDS, Ehlers-Danlos syndrome. And Ehlers-Danlos syndrome being a condition where there's hypermobility throughout the body. So joint laxity, meaning the available movement within a joint, is increased above the standard of what we would think is normal. Okay, and so this population tends to also have an improper inflammatory response, and frequently will present with migraine symptoms. And so what's happening here is the body needs to compensate for the excess joint laxity by stabilizing using muscle primarily to try to add the stability that's not naturally there through the skeletal system, okay? So joints should move to a certain degree. If they move too much, we're lacking some stability, and so muscles need to kick in to pick up the slack. So the excess movement, the lack of stability is something that can be a problem. So that lack of stability over time leads to like the compensation patterns, the excess stress through the muscles that surround that area, and then irritation, whether it's through the joint itself, the ligaments, the tendons. So, and then the muscle tissue itself can be irritated. So when there's irritation, that pain signal is sent, there's local inflammation, and then the brain receives that signal and says, okay, something's wrong, and misinterprets it as coming from the face, the head. That's referred pain. Okay, so that's kind of the process that we're talking about. Okay, what's important to understand here is that not everyone that's dealing with a headache or migraine is necessarily dealing with hypermobile joints. Okay, so one of the primary things we work on here is hypomobility within the upper part of the neck. So we're finding that there's restrictions between the head and the first bone and the first bone and second bone. So C1 and C2, or the atlas and the axis. And so the lack of mobility through those segments can trickle down and lead to increased stress through the mid portion of the neck. And over time, the mid portion of the neck basically is having to do more work than it should. Its range of motion is being asked to like push past what it's comfortable with. And then there's an added level of stress or wear and tear through the mid portion of the neck. All right. And so there's a couple of things here. So we've got a patient that we've got a scenario of a patient that's dealing with hypermobility in the neck. Let's say it's a young female that has positive signs of like Ehlers-Danlos syndrome, or maybe they're just like not as stable as they could be. And so their neck is having to work overtime to try to keep the weight of their head upright and accommodate to all the movements and stresses placed through it throughout the day. And then we have, on the other end, we have a scenario where someone has restrictions in the upper part of the neck, maybe from like a whiplash injury or repeated trauma to the neck, something like that. And the restrictions following like those types of injuries in the upper part of the neck lead to hypermobility or just wear and tear stress on the mid portion of the neck. All right, so when we think about our model, our 3-spoke framework, which I'll lay out briefly for you, but there's a mechanical issue. There's something mechanical that's leading to a pain signal being sent. So that's spoke 1 in our framework. Spoke 2 is developmentally, things that can be barriers for someone. So their body naturally didn't develop, or there's developmental things that physically are impacting their body. That's spoke 2. And then spoke 3 is systemically. What are things systemically that lower someone's threshold? Okay, so all these factors have to be taken into consideration when we're evaluating something and seeing if they're appropriate for a certain type of treatment. So a couple of things with prolotherapy. So when it comes to the situation where there's a patient with hypermobile joints kind of throughout their body, and we're trying to shore things up and add collagen and stimulate the local ligaments or tendons so that there's more stability naturally through the spinal column or something like that. The mechanism of prolotherapy really does, intuitively to me, make sense to attempt in that scenario. So we see often that the compensation will be there's just tissue tension kind of throughout the neck, throughout the shoulders, a lot of compensation patterns. And so we're dealing with reversing all of those things. And so prolotherapy I could see makes sense. Okay. And now we're going to talk about if that means we jump into it right away or if there's other options. Okay. So that's one scenario. The other scenario is someone who's been through like a series of concussions or whiplash injuries, things like that. And they have restrictions through the upper part of the neck. The mid part of their neck's taken on quite a bit of stress. And so in that scenario as well, not necessarily in the acute phase. So it's not as if you are in a car accident, whiplash injury, and like immediately you need to go get prolotherapy. What we're talking about here are more chronic conditions where the body needs something to help it stimulate healing and in a specific segment of the body. So we're talking about the neck here. So this is the first spoke in the framework. This is the actual mechanical issue that we're addressing within our framework. This is treatment for the mechanical problem. Joints and ligaments are often a source of pain themselves. Okay, so injecting prolotherapy to stimulate healing locally, I can see that being effective, and then injecting prolotherapy for the purpose of stabilizing the segment so that those compensation patterns and the instability that causes muscle tension, I could see that being helpful as well. Okay, so those are sort of the ways that we would reason or think through this as far as taking prolotherapy and providing that as a solution to someone. Now, why aren't we just sending everyone off to try to get prolotherapy? There's a few reasons. Okay, so one, as physical therapists, we want to provide the most conservative approach to treatment first. And what that means is we want to restore the normal function of the body. And when we restore the normal function of the body, we should see these pain patterns reduce naturally. Okay. So injecting a solution, the sugar water, into the targeted tissue in order to stimulate the healing process, I would put that in a category of it's definitely a more conservative approach than if we were going to go like surgery or potentially even medication or injecting something like a steroid into the area where we're just shutting off the inflammation, shutting off the pain itself. So the idea behind prolotherapy I like better than most medical interventions, but it's still something that should come after a more conservative approach, which is trying to improve the mobility and stability of the neck in order to allow that patient to find relief outside of a procedure such as prolotherapy. So prolotherapy coming after conservative treatment. So what does conservative treatment look like? That would be evaluating the specific segments of the neck that are restricted, evaluating the specific segments of the neck that are hypermobile, looking at the patient as a whole. Are they compensating? Is their neck coordinated and moving the way it should? What is their muscle tension like? Where do they hold their stress? How are their shoulders playing into the amount of tension through their neck. So all of those things are factors that aren't necessarily going to be resolved with something like prolotherapy. So we need to lay the framework for someone finding relief through just traditional methods of physical therapy, or maybe not. It's traditional principles applied to a headache and migraine patient and the neck, which is essentially what we're doing here. Going to see a physical therapist and them taking you through, some sort of posture corrective program may be helpful. What we do here at Novera is specific to targeting those segments in the neck that are restricted, improving stability when stability needs to be improved, and looking at the whole picture through that framework that I laid out. Okay, so conservative measures need to be, so basically going through a traditional physical therapy process. So when you come to see us, we would take you through our process, restoring mobility, improving stability, and making a checklist of the things that need to be addressed, and then working through those naturally. So it's not as if your body needs to have this localized injection to stimulate healing in order to improve. There's lots of other ways to improve function, reduce pain levels, so that you can find your way out of these headache and migraine situations without having to go down these other more invasive roads. Okay, but just to back up again, the prolotherapy is an intervention that I would say I like it as an option better than say a more traditional like medication or procedure, like an injection of a steroid or an ablation therapy or something like that. All right, so research says there's a need for more high quality studies out there. So when we think of high quality, it's like systematic reviews where they pull from randomized controlled trials where there's, the intervention applied to two parties. One is blind to the intervention, or they're not influenced by the perception, or if they are, it's equally influenced by the perception of something going into their body, the injection. One receives it, one doesn't. Things like that. So high-level randomized controlled trials are needed. But right now we have small studies, case reports that show potential for improvement with chronic neck pain, headaches, and migraines. So again, these aren't necessarily like acute whiplash injuries that you have acute inflammation and then you go in for prolotherapy. It's more of the chronic, like we need to stimulate healing within this part of the body type of conditions. Some patients with cervicogenic headaches have reported lasting relief after prolotherapy, and then there's some case series suggesting benefits with migraines linked to the upper cervical spine being dysfunctional. Okay, so one thing I like about this is it's providing a mechanical solution to something like migraines, and so prolotherapy having even something like a case series where you follow a person or multiple people through the treatment itself, and you take a snapshot of where they are when they start and then where they are at the end, and maybe follow-ups down the road. So that sort of research pointing to something like prolotherapy, which is producing or stimulating the healing process on ligaments, on tendons, and that being successful tells us that the ligaments and tendons in the upper part of the neck were a problem in the first place. And so it validates, again, what we're doing here when we're looking at the upper part of the neck in relation to migraine symptoms, okay? So there's a large chunk of our healthcare system that would say migraine is different. That's not a neck issue. And so prolotherapy being effective for migraines, injecting it into the upper part of the neck and that assisting with healing is evidence to say, no, there's something going on in the neck, which is good. We like that. Okay, and then the prolotherapy itself, like I said, under the guidance and direction of an expert that can evaluate your neck properly, it's going to be most effective when instability is the driver of what's happening. So the unstable joint, the unstable segment of the neck being being the target for the injection is going to be most appropriate. And it's not as if everyone we see with a headache or migraine presents that way. And so there's caveats to it, and your specific situation, like I said, needs to be evaluated by an expert. And so that's something that we talk people through here at Novera. We evaluate them, take them through our treatment process, and so they can understand what exactly how their neck presents and what the underlying problems may be. And so hypermobile, unstable segments of the neck would be the category of like, okay, this is the problem that's leading to your symptoms. They'd be a more likely candidate to find relief from prolotherapy. Okay, so we have basically an understanding of prolotherapy. It's an injection, stimulates the healing process, lays down collagen for joints that are unstable, ligaments, tendons that have either been injured or we need to stimulate the healing process in. We're looking at the neck as the underlying source of the headaches and migraines, but we need to understand who this specific treatment might be appropriate for, and if they've tried conservative measures and there's still an element of their story or of their healing that we need to address, and we feel like prolotherapy is going to be effective. And like I said, I would put prolotherapy in a better category than like the traditional treatment approaches within our healthcare system. It's not for acute trauma, and then there's definitely different other types of migraines, like or migraine triggers that can dominate someone's presentation. So if it's a hormonal situation or systemically, if it's like a gut health or a systemic inflammation issue, there's different things that would play into this needing to be a part of someone's treatment plan as well. And so the more we see someone who's the driver might be hormonal related or systemic, and inflammation is their issue, or estrogen levels being all over the place, dramatic swings in their hormones, those are things that that would lead us down solving those problems first. Okay, so again, not a blanketed, if you have a migraine, go try this type of thing. And that's, again, the whole point of this podcast is to inform, educate you so that you have more information. And so when you go talk to your provider, you can say, hey, is this something that would be helpful for me? All right, so I said we're going to relate it to dry needling. Dry needling came up in my mind because dry needling, one of the intended purposes of dry needling is to inject the needle for the purpose of causing local inflammation and stimulating blood flow to the tissue itself. So dry needling is using really tiny needles without a hole in them, so there's no lumen or hole to inject anything, and so that's why they call dry needles. And so you use the needle itself to change or intervene with the tissue, and the tissue in this scenario is going to be muscle. Okay, so we're not necessarily dealing with tendon or ligament, although there are dry needling approaches that you can stimulate healing in tendon or ligaments. And so there's similarities in dry needling. And most physical therapists, at least here at Novera Headache Center, we will utilize dry needling for the purpose of stimulating blood flow, local inflammatory responses, sort of irritating the local tissue, the muscle, or it could be the ligament or the tendon, in order to stimulate that healing response. Okay. Some of the differences here, so dry needling, we're not injecting anything, we're just using the needle itself. So it's more of a mechanical approach to stimulating healing and local inflammation. Whereas prolotherapy, obviously there's the solution that's injected, and then the dextrose acts as that irritant. Prolotherapy is going to be more specific to ligaments and tendons, whereas dry needling, by and large, is going to be used to intervene with muscle tension. And so both are going to be involved in most people's scenarios, okay, because the body doesn't necessarily just have like an isolated problem, like all these systems play into each other. But both can assist in improving joint stability and reducing pain, okay? So if you're working with a physical therapist, or if it's something you're interested in as far as like, hey, could prolotherapy be a solution to me? There might be avenues to trial dry needling and see how your response is to dry needling. I'm not saying that dry needling is the same as prolotherapy. Obviously, there's differences in how the needle is used and the targeted tissue. But for the sake of like getting something that's similar and a more conservative approach, dry needling could be the option there. All right. So as far as our approach at Novera, again, we would assess movement, we would assess dysfunction, we would look at the patient as a whole, the overall health, what is driving these symptoms, how mechanical is it, what specifically, when we look at neck, jaw, shoulders, is the problem, and then go through the conservative measures first, the treatment that we would provide here. And then once we get to the end of that, we would evaluate that, and something like prolotherapy could be a recommendation if we feel like it's appropriate to help shore up or address instability, something like that. So prolotherapy will continue to be studied and utilized, and so as research continues to come out, we'll try to stay on top of that and educate you guys if there's more information that or new information, which I'm sure will come out. And we want to make sure you guys are aware of that. And so if you're looking for headache or migraine relief and you have yet to find it, this podcast serves as another potential avenue of like, hey, maybe there's something else out here that I can try. Like I said, conservative treatment being first, I would suggest you reach out to us and we can help you navigate that, especially if you're in Colorado. Give us a ring and we can get you on our schedule and start you down this process of understanding how your neck can be related to your headache and migraine, and if something like prolotherapy could be in your future. Okay, that's not I didn't say this, but prolotherapy is not an intervention that we provide here. It's an intervention that our scope of practice as physical therapists wouldn't allow us to do at this point. And so we'd have to find another provider, referral source. Maybe at some point I'll have a provider on here that uses prolotherapy, and then we could get their perspective on it as well. If you know of someone that is effectively using prolotherapy for headaches or migraines, treating the neck, pass their info along, and I'd love to connect and learn more about it myself. Hey, thank you guys so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.